Well, let's get the latest now. We can cross to Ankara and speak to our correspondent there, Jasper Mortimer. Jasper, a full national lockdown, that sounds like a pretty drastic measure.
Yes, it is. And it is the first time that Turkey has had a full lockdown across the whole country for more than 2 weeks. What happened was that in February, we had the situation under control. We were having 60 to 70 deaths a day. You can say one death is too many. But for a country of 84 million people, 60 to 70 deaths a day is a low figure. Then, in early March, against the advice of the Turkish Medical Association, the government eased restrictions, allowing people to return to restaurants and travel between cities. And the effect was dramatic. Those testing positive for COVID rose from 6.5% on February the 21st to 19% on April the 21st. The government put the blame on the invasion of foreign variants, which spread much more quickly than the normal virus. The Minister of Health said 85% of the new infections could be traced to the British variant. But the head of the Turkish Medical Association, Dr. Sebnem Funjanji, said the government knew from experience what would happen if it eased restrictions prematurely. And she accused the government of social murder. Now, as you said, the latest death toll is 341. Last Thursday, we had 354 people dying. So we are in trouble. And the government has finally taken the drastic steps that the doctors have been calling for weeks. The opposition leader, Kemal Kılıçdaroğlu, the leader of the Republican People's Party, said today that the government should have imposed a full lockdown much earlier. He didn't give a date. And it's thought that the government hopes that the lockdown, which has just started, can bring the virus infections down to tolerable levels before the start of the tourist season late May.